Good morning, KRTA. It's Jane Gilbert. My favorite topic and yours, retiree health insurance. The good news is you're going to hear some vendor clips coming later in this presentation where our insurance vendors are going to give you updates on their particular programs. I'm just going to spend about the next 5 minutes with you talking about insurance in general with a few highlights and updates. Thanks for allowing me to serve retired teachers of Kentucky, now in my 18th year. As you know, we have 2 retiree health plans that cover the retired teachers of Kentucky. The first is the KHP, the Kentucky Employees Health Plan. It covers 13,000 retired teachers and their dependents, and that is a plan that is administered by Anthem Blue Cross Blue Shield and CVS Caremark. We also have the MEHP, the Medicare Eligible Health Plan. That covers 37,000 retired teachers who are Medicare eligible and over the age of 65, including their spouses. And that is a fully insured Medicare Advantage plan through United Healthcare and a self-funded Medicare Part D drug plan through Express Scripts. Now, many of you have heard me speak before in regards to shared responsibility, and we're now celebrating the 10th anniversary of shared responsibility, also known as House Bill 540. Very exciting time to see that past 10 years ago, and 10 years later, still exciting to see it work on your behalf. So the 4 new revenue streams that we have brought into your medical insurance fund, it's working. And we are beginning to pre-fund your medical insurance just as we are pre-funding your defined benefit pension plan. In fact, your medical insurance fund is now 46% funded. So as of 2019, we are 46% funded due to your efforts with shared responsibility, due to your efforts with Medicare Advantage, due to your efforts with Medicare Part D. We have $1.5 billion in your medical insurance trust fund. Remember, that's not a surplus. That's not a surplus where we've somehow charged more premiums than we should have. That $1.5 billion represents 46% of the liability we have for the next 26 years to cover retired teacher single coverage insurance. Now, if we were to look at the medical insurance fund and just look at the obligation for those that are on Medicare, you could consider us to be 62% funded towards that Medicare eligible obligation. Also, the good news is that's projected to be fully funded, 100% funded in 5 years from now. Once the Medicare eligible health plan is fully funded, then we will begin to pre-fund the under 65 coverage until that becomes fully funded. Also, good news, the state has paid their 4th leg of shared responsibility. So we were able to receive $70 million from the state for their 4th leg of shared responsibility. And we are certainly thankful for that. More good news in regards to the MEHP, the Medicare Eligible Health Plan, and that premium. As you know, for 2020, the premium is running $224 per month. Again, that would get you the Medicare Advantage plan and the Medicare Part D drug plan. So running $224 a month here in 2020. The good news is that it was costing $232 a month 18 years ago. So back in 2002, the premium was $232 a month. So with your help, in so many ways, we've been able to reduce the premium over 18 years and keep the benefit as efficient and effective and as valuable as possible. And you've helped all the way, again, through shared responsibility, through Medicare Advantage, through Medicare Part D, through the Pharmacogenomics Project. You name it, you are definitely part of the solution, and I thank you for that. Another of my favorite topics, personalized medicine. We rolled this out to you in late 2017, so we're almost 3 years now into our personalized medicine program. Another bit of good news, we are getting some national attention about this program, and so I have had the opportunity to speak in Boston and other areas about the success story that we've had with this personalized medicine program. Everyone knows that nationally, about 50% of all drugs prescribed don't work for the person as intended. We also know that the fourth leading cause of death, unfortunately, is adverse drug reactions. Looking early at our data before we started this program with KRTA Life Sciences, we knew that about 83% of our retirees were taking a drug that had a genetic implication. We also knew that at least 75% of our retirees had high blood pressure, 58% high cholesterol, and 50% having pain and inflammation. All of those are conditions that the drugs used to treat definitely do have genetic implications. As you know, we partnered with KRTA Life Sciences, the Know Your Rx Coalition Pharmacist, and of course TRS of Kentucky, and came up with a personalized medicine solution that is now 3 years into the program, and we've had some good success to share with you in regards to that. But first, I must indicate that the secret weapon here in this program has been the pharmacist with the Know Your Rx Coalition. Their ability to talk by phone with 7,000 of our retired teachers and explain and summarize the medication action plan produced from their genetic DNA test, to explain it in a way that the retiree can understand what they might be a slow or fast metabolizer of which prescription drugs, and then with the permission of our retired teacher patient, they would reach out by phone to the prescribing physician to discuss with that physician, would it be okay if we tried a different drug based upon this patient's ability to metabolize or not metabolize this drug appropriately as a result of this DNA test. And as you know, what we found here with the 7,000 folks that have been tested is DNA matters. Your mom and dad matter. How you metabolize drugs through your liver matters. So you can be an ultra-fast metabolizer of drugs. You can be an ultra-slow metabolizer of drugs. You can be fast with one drug and slow with another drug. Again, this is all because of your genetic makeup inherited from your mom and dad. Some of you are just perfect metabolizers too. So you're perfect, intermediate, fast, slow, you name it. KRTA Life Sciences gathers that genetic information. They empowered the pharmacists with the Know Your Rx Coalition to communicate that medication action plan, not only in a way that the retired teacher can understand, but in a way that the prescribing physician can also understand. Results have been good. So again, 7,000 of the 37,000 participated. We've seen 28% of those 7,000 result in a medication recommendation change due to the DNA test itself. So that's 28% recommended drug changes due to the DNA test itself. KRTA also looked at about 2,000 of the 7,000 folks that volunteered for the DNA test, and they looked at the 16 months worth of prescription and drug claims and medical claims after they took the test. And then they compared it to 2,000 folks with similar risk scores that decided not to volunteer for the test. And we saw a 14% reduction in the claims, both medical and prescription, for those that agreed to take the test, and a 3.2% increase in both prescription and medical claims for those that didn't take the DNA test. So as you can see, early results, the first 16 months, are demonstrating that these test results are guiding folks to actually contain costs and get on the medicine that works for them, and the goal being to take the medication that's right for you at the right time, at the right price, at the right dosage. Other metrics of success, kind of the good news is, for those 28% recommended changes due to a drug to DNA implication, the prescribing physician accepted those recommendations 87% of the time. KRTA also saw a 22% reduction in hospitalizations for those that took the test. They also saw a 27% reduction in slip and falls for those that took the test. Member feedback has been tremendous. A lot of thanks. Thank you for, this is what healthcare should be. Please, if I've got to take medications, please help me know that these medications are working right for me. 70% of those surveyed said it was a valuable program. Other good news is we are rolling this program out. The personalized medicine is being rolled out to the 13,000 under 65 retired teachers on the Kentucky Employees Health Plan. They will need to use their WageWorks card, their HRA funds to pay for the cost of this test, but it is being rolled out so that they may also participate. So that's very, very good news. Thanks for lending me your ear here over these past few minutes, and now you're going to hear from our funding expert. Thank you.
Hello everyone, Bo Barnes. I serve as Deputy Executive Secretary of Operations and as General Counsel of your retirement system, TRS. I'm going to talk today briefly about what we might expect with the upcoming 2021 legislative session that will convene in January. But first, I would like to talk a little bit just about the past session that ended April 15th. And that was a good session for TRS. It was as an even-numbered year session. It was a budget session. But unlike most budget sessions, because of COVID and because of concerns about Kentucky's economy and the revenues coming in, the General Assembly enacted a one-year budget only instead of a two-year budget. But there's good news in that TRS received the full funding for the pension and for retiree health insurance in that one-year budget that began July 1st of this year and runs through June 30th of next year. And that is fantastic news. We're very appreciative of that. And that full funding is so important for many reasons. Maybe most important, or one of the most important of which is that it allows TRS to implement its funding plan to pay off its legacy unfunded liability. And as many of you are aware, we have an unfunded liability, and that is the shortfall in assets we have today on hand to pay for all the benefits that have been earned by active and retired teachers. That unfunded liability stood at $14.5 billion, June 30th, 2019. And that's a big number, but the good news is we have a lot of time to pay it off because those benefits aren't going to be paid just over the next few years. They're going to be paid out over decades. And so what we're doing with our funding plan is we're going to achieve 100% funded status over a 30-year period with this plan. And we're already into this plan several years. We have about 25 years left in the amortization period. And when we get to 100% funded, the cost of TRS is very inexpensive. In fact, for the Commonwealth of Kentucky, the cost is a little less than Social Security. So very important we're getting this funding to implement the funding plan. Also, it's very important for investments, our investment process. One, before we give additional funding, we were experiencing and developing a cash flow issue. So that, for example, there were times when we were selling assets in down markets at lower values that we didn't want to sell, and then conversely, we didn't have the cash liquidity to purchase certain assets like stocks in those down markets. With this funding we're getting now, that's all changed. It's all ended. We are able now to buy low in down markets and sell high in up markets. So great, fantastic news there. We're very appreciative to elected officials providing this additional funding that we're getting now. Now, coming out of 2020 session, we're in a good spot and looking forward to 2021. I think there's reason to be optimistic. One of those reasons is that in the several versions of the budget that came out before COVID, when they were still two-year budgets, all those versions contain full funding for both years of the budget biennium. And there's a caveat in that those versions of the budget, including the current one that passed out, could potentially have the Commonwealth of Kentucky paying somewhat less into the health insurance trust fund than is requested. But given the fact that those budgets did signal the intention anyway of full funding, and that we've had statements and recent statements by elected public officials that we need to fully fund TRS. There's a lot of room for optimism of where we're headed with 2021. One more thing you might hear about just very quickly about in 2021 is that, there's been a lot of bills filed that would make a benefit structure changes for TRS, particularly for as a new tier for new teachers. And in recent bills that were introduced in the General Assembly were just for new teachers. They did not impact the benefits for existing, active, or retired teachers. Those discussions have been ongoing. They continue today. So I wouldn't be surprised if we see some kind of pension legislation introduced in the 2021 session. So with that concludes my presentation today. I appreciate the ability to work for you. And as always, if you have any questions about your retirement system, please feel free to contact us. Thank you and have a good day.
I want to thank all of our presenters this morning. They've all done a wonderful job and they continue to do a great job. But I want to also thank you. I want to thank you for your support of the retirement system. It's the one thing that it's the consistency that we can count on is your support for what we do for you and how we carry that out. So I do want to thank you for that. Also, stay diligent, watch for the bills that are filed, all those type things. And again, Tim and staff at KRTA do a great job. And your board and your structure that you have does a wonderful job in keeping up with your pension, your benefits, and they make it easy for all of our teachers to have a secure retirement. So with that, thank you very much for watching this morning. And we look forward to hearing questions from you, and we'll be glad to take those questions. So thank you very much.